Thank you. Thank you. Oh, sweet. Thanks so much. Good seeing you. I see many good friends here, so I owe you $5 later. A lot of y'all came out, and I appreciate that so much. And right now, what happens, it's service week at Signature, so everybody should go out and work a shift. So right now, we're doing this movement where we're trying to be the first company to be kind of all CNA based for the whole company. So we're trying to launch this idea around universal caregiver. So right now, I worked at 6 a.m. shift at Four Courts on the Linker Hall. And I saw a lot of things to work on. So I got a new list of things to work on. But I think the whole idea of how do we get back to bedside, what do we do as leaders to engage our people? And so I think this whole movement on CNA is very interesting to us right now today. So first thing is, appreciate you coming. Part of what brought us here originally back to the city was an idea of could we improve public health? Could we connect things differently? We felt like we weren't in the dialogue in South Florida. So we came back to Louisville with just a way to say, we want to contribute, we want to pay our share, we want to work hard on risk sharing. So it's really kind of a launch of us to see if we can't make this be a transforming city right now as we look at healthcare in general. So the IdeaHour has been a great thing. Y'all have had big crowds, obviously. John did a great job with the IdeaHour. I want to thank you guys for doing this, and Vicki. But today's speech is 20 minutes. I usually get this because I can give an hour talk in 20 minutes. So it'll be quick and to the point, okay? So if I say anything wrong or too fast, grab me later. I try to make sure I'm not boring. So we're gonna break this speech into 3 parts. First part we're gonna do is just look a little bit at historical public policy in the country just to try to make sense of what's happening today. Right now, it's so uncertain and it's so crazy, I have to go back and look at history a lot of times to really decide where we are when it comes to public health. Second thing is we're gonna give you a back channel of what's really going on, not in the paper, but what this real skinning is around the state of the industry. And then we're going to get into 20 quickly future predictions for Louisville and sector. So we're going to try to look at different industries around healthcare. So we'll look at the past, the back channel, and what's going on in the future. And we'll try to give you our predictions. Our predictions do not invest on, do not take your family trust. This is some of our predictions of what we see happening as we travel the country and look at solutions. So first thing is, I think if you look back at the country, being a little bit of a policy person, it's been very difficult to get the economic viability of the country with where the industry is in an application-based way. And so when you look at public policy, if you go back even the Civil War, the gold rush, every period we ever had in public health policy, it's been very difficult to match all 3. And so you go back, we did a gap analysis almost for the past 150 years, and you see big gap analysis that's been almost a reoccurring theme. We've had national home health, we've had national HCBS, everything in the current plan, we've tried 5 times. So even though we rename it something cooler, we've tried it a lot of times. Historically, it's been there before, and was a revisit in the past. So keep that in mind as you think about your job security. Do you double down? Do you quit? What do you do? We think there's a lot of historical lens you got to have to really see the future properly. So we think about that issue. We're going to kind of close the gap today. And most of the times when the policy's off, it's where we have some unforeseen public event. And so in our nursing home business, how it first started, people left for the Civil War. And so obviously people passed away. There was no caregivers to take care of the mother. It was a gold rush that rushed for the West Coast. So historically, there's been some kind of family disruption that creates a care continuum problem. That's kind of what's happened. So keep that in mind. The first thing I want to think about too about public policy, we're going to break it down into 3 phases today to keep it quick. The first phase is really about trying to prevent and manage communicable diseases. That was kind of where I think the U.S. has done the best work. And then the next 40 years we're coming out of was really the kind of studying of chronic diseases around, kind of environmental conditions, genetics, what's going on in chronic diseases. And that's really what built most of the policy of the past 40 years that said we had to have a hospital in each town, like the Hill-Burton bill. All the things that happened that built this elaborate system was built around phase 2 of public health, which is the studying, the managing, and the environmental conditions around chronic diseases. And now we're in the point where I think we're the country that's in the final phase of public health, which is how do you curb cost inflation? How do you look at cost containment? In this phase, if you look at all the bills in the past 5 years, they're built around cost containment, through transparency, through better alignment, and we're going to see the first time, I think we're going to see a massive remove of underperformers. And I think if you look at the dashboards out there in the world on most provider sides, we're seeing that bad performers stick out pretty quickly. And so we're seeing that this new branch reporting is going to do a mass consolidation. For example, I was at University of Miami's board meeting yesterday down in Miami. It's mainly international board. And you see the problems, even internationally, are bigger than our problems here. Our media kind of beats ourselves up a lot, but we have probably better solutions here than other countries. And when I sit around the international board, I always say, thank God I'm in the US right now. So a lot of things to think about there globally. So in that third phase of cost containment, we started looking at, what do you need to be in? And so we started realizing that our mindset around collaboration, around risk sharing was the right mindset. And I think we're also in a phase right now for the next 5 to 10 years is going to be focused on this elimination of underperformers and this transparency. So if we think about the 3 phases and we say, what's the historical lens of the government? I think we can bank on this. They'll always over-incentivize us to build a business. And so you can go back to L-Tax, home health, all the business ever built, and it was this kind of frothy period you're paid really well. Everybody agree? And then secondly, there's the take-back period. We paid you too much, now you're in the business, now you're personally at risk, let's take it back, we treated you too well. And that period is usually a period that's very difficult to get mixed signals on. And the third phase is how do we get costs in line and balance quality. So that's the historical lens we've had in every provider segment for the past 100 years in the country. So keep that in mind depending on what provider network you're in, how it plays out. So when we think about what it really means for us, what makes, I think, all of us difficult in the room is, and some of the facts we got to think about is, we're trying to really service almost 4 healthcare systems. And so you think about our side, it's rural, it's urban, it's indigent, non-indigent. So we're trying to interface with really 50 states with different policies and really 4 different healthcare systems at the same time. So it makes it very difficult for us to build kind of best practices because you have all this variance in design. Other factors we think right now that are really important to us is in long-term care, every heritage, every religious group uses things very differently. And so we see a different utilization model of how we treat people based on heritage and demographics. So that makes it harder to build pathways as well. And at the end, real quick, there was a group called Assisted Living that came in and took almost every healthy person we had out of long-term care. So if you're in the assisted living business, anybody in the room in there, good days for you all, right? But I think what it did for us, it took about 1/4 of the population away from us. And so now we're down to really 3 groups left. We're down with the chronic disease, multi-system failure group. We're into this, how do we deal with Alzheimer's, dementia, mental health in general, which is our largest population base, and then kind of the rehab to home group. So in the old days, we may have 6 bases. Now we're down to kind of 3 bases that we're trying to deal with. And we weren't built for that level of chronic disease design. And so we're really struggling with that right now in terms of corporate programming and the facility side. So there's a big disconnect right now in the country that's going on, causing a lot of problems. So let's think about this a little bit. So the back channel I'm going to give you today in our space is people are very scared and people are nervous about everything. So what I try to do is find peace by going back and look at historical policy so I don't overreact or overplay my hand or become too defensive. The other thing right now happens if you benchmark the top 30 chains in America, you're seeing a clear separation between top premium and non-premium. And it looks like to me a lot of the non-premium companies won't make it in this next round because the variance reporting is too strong and too fast. Next thing we're seeing is that there's already a scheduled 2% Medicare cut again for next year on top of this piece. And that's kind of like a new tipping point. So I ran out 50 deals we looked at acquiring this past year. And if you put another 2% Medicare cut in and you put the Med-Mal in at the level it's going to be without tort reform, and you look at any kind of Medicaid flatline, you see they really can't survive the next cycle. So it kind of forced that whole massive consolidation. What do we do now? Next thing that came up to play is, first time I've been in the business ever, we actually have CNAs in excess. So hospitals are going to lay a lot of CNAs off. It used to be a real fight for CNAs, but during all the recession and the retail consolidation, we're seeing some movement there that we're actually having a lot of excess CNAs that we can get to pre-selection now, which is great for us. Next thing is we have a lot of people that call me and say, I wish I would have sold 3 or 4 years ago. I didn't know it was bad. Do you want to buy us now? We always say no. We have our own problems. We think there's some big deals done around town, around the country, in 10 and 11. Some mega deals. We're not going to mention names, but we think some of those could be regretted because they were big deals at big prices. And I've been around the block for 20 years, and anytime you see major deals done before a contraction period, it's tough to find valuation. So we think some of those could be regretted down the road. We do think we're going to see a pushback, at least in our space, to not look at going public as the best answer. We're starting to see that you can raise as much money going private as you can public. It's hard to get the average investor to understand all the complications we deal with in the room. So we do think we're going to see more public market data going out. I know some people that are in public world that do a good job with it, but we're seeing more people push into boutique private firms starting up. Last comment about the current back channel today, and we'll get into predictions, is I've never seen this gap so bad between a corporate office trying to aggressively program a facility, and we got to hit these numbers. And the facility people who hold the license, their career license and the facility license, saying, I don't agree. And so what's happened is it's very hard for people, their license is a right to how they eat and what they put their whole life doing. So we're seeing a little bit of push-pull model. It's really getting the gap widened because people feel a need to hit certain numbers to survive. At the same time, we've got more RAC audits, more fraud and abuse exposure, more recoupments. So if you're that operator on the hook, it's a very scary period. So we're seeing some real gaps there. So we've done right now in our company, we've almost cut every earning production. We've really said, you know what, it's not about money. It's about getting back into CNA uniforms, forget making money for the next 5 years and forget all about that, and just kind of scale your goals back so we don't have that big gap right now in our company, which is a struggle for all of us. Let's talk a little bit about predictions, and I want to leave time for the Q&A.